first collaboration with Columbus Young Professionals. They're kicking off their Columbus Young Professionals Week that was delayed from April. We're grateful to share kind of this important information with the community today. We're also grateful to partner with Columbus Young Professionals, Columbus Rotary, and then also with Dana at Vogelmeyer Consulting too as well. So kind of over the next hour, we'll talk about important issues facing the community, especially pediatric medical access and family social justice issues. During and after the main discussion, we'll have time for question and answers. So if you want to drop anything into the drop box as we're talking, Dana will be monitoring the drop box for questions. Obviously we just talked about Zoom. We've all been on many Zoom calls, so we want to make this interactive. I know Kelly and Jillian, want to definitely, make this as interactive as possible over the next hour. I'll introduce myself. I'm Alex Hanselman, a member of Rotary here in Columbus. Columbus Rotary's mission is to provide service to others, promote integrity, and advance world understanding, goodwill, and peace through fellowship of business, professional, and community leaders. Our members here in Columbus and across the world believe that we have a strong responsibility to take action on the world's most pertinent and persistent issues. Clubs work together to foster action in key areas such as promoting peace, saving mothers and children, and we also fight disease. We advocate for clean water, education, and grow local economies. So today we're focusing on the promoting peace and saving mothers and children, with the two speakers that are here today. Love to introduce Dr. Kelleher from the Columbus Nationwide Children's Hospital, and then also Jillian Olinger from Columbus YWCA too as well. I won't continue to talk. I'll let them kind of take the reins and the wheel, so to speak, and let them introduce themselves, and then also kind of get into our subject matter for today.
Jillian, please, why don't you lead us off? Jillian, you're on mute. I hope you can see your mute button.
I'm going to get there this afternoon, I promise. As Alex shared, my name is Jillian Olinger, and I'm the Chief Mission Officer with YWCA Columbus. And for those of you who aren't familiar with our organization, just a little bit of background about us. We are one of our city's legacy institutions and have been serving our mission to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all for over 130 years. And we were founded originally with the goal of providing young women who were coming to the city seeking economic opportunity with a safe place to call home. And we continue this service today through our two housing programs. 91 units of permanent supportive housing located downtown for formerly homeless women with a certified disability. And then also our family emergency shelter over here on the Near East Side. And this year we're actually commemorating our 15th year providing this service to the community. So very proud to be able to offer that to families in their time of need. We also run two leadership development programs. So looking to create the young women leaders of tomorrow to carry forth our mission, really equipping them with an in-depth understanding of structural racism and sexism, social justice broadly, and then finding their own voices to advocate for change in our community. And then we also engage on public policy and advocacy issues. We have our advocacy agenda that we just unveiled at our recent Women of our WOA leadership events just a few weeks ago. So that's a little bit about us. So just a couple of objectives for today. Don't have a lot of time together, but I do want to at least give a brief overview of how past and present racism have impacted health outcomes, looking specifically through the lens of housing, and then tying that to the importance of declaring racism as a public health crisis. Next slide. But to begin, I want to unpack for us so that we're all kind of on the same page, really an understanding of racism as a system, and giving some brief definitions, though, of these three different forms that racism can take. So at the individual form, we can think about that as the room that we're sitting in or our immediate environment. And individual racism really is about prejudice and bias. It's about racist acts. And it includes both internalized racism, so what our private beliefs and biases are about race. This is also influenced by our culture and different messages that we receive about races. And also interpersonal racism, that happens between individuals when we interact with others. And that's really how our private racial beliefs affect our public interactions. So you might also be familiar with the term implicit bias. That can also show up in this space, which implicit bias, if you aren't familiar, are those unconscious stereotypes that we hold. If individual racism is the room that we're sitting in, institutional racism is the building that room is in. And that's really describing the policies and the practices that really dictate how we live our lives. So institutional racism includes policies, procedures, practices, all that work better for white people than people of color. And often that's unintentional or inadvertent, but over time, it's individual racism and beliefs becoming codified into institutional practices. And then finally, structural, you can think of as the skyline of the buildings around us. And structural racism really encompasses everything, right? That's our history, it's our current reality of institutional racism across institutions. So now we're looking at all systems together and how they combine to have negative impacts on communities of color. So the structural level, again, is referring to history, to culture, to ideology, and to the interactions then among and between institutions that perpetuate then inequality without any conscious decision making. This is just, that is the status quo. So to summarize, while racial stereotypes are the symptoms of racism, so not liking someone because of their race is a form of bias or prejudice, and that can exist solely on an individual level, but racism exists on institutional and structural levels. So racism is a system. That's another way to think about that. So those last two levels, institutional and structural, are where I will focus the majority of my remarks today. Next slide. And in this next section, I'll take a deeper dive into structural racism and how housing has been used to facilitate structural racism, both historically and even present day. And then make that connection to the social determinants of health. Next slide. So housing is really one of the cornerstones of opportunity in the United States. And secure and affordable housing in neighborhoods of opportunity matter fundamentally for the health and well-being of people. And research, decades of research on neighborhood effects and on the social determinants of health really bear that truth out. It also matters in economic terms, in terms of the ability to find and keep affordable housing, how that matters for individual bottom lines and the ability to grow and draw on equity, for example, but also our national bottom line. And I think the recession of 2008 really drove that point home for the country and for policymakers as well. But despite the importance of housing to life outcomes, in our country, we have seldom, if ever, used housing as a tool of empowerment for Black people and allowed it to function as that cornerstone of opportunity and the intergenerational transfer of wealth that so many white households in our country have been able to experience it as. And instead, we have used housing as a sorting mechanism and a way to separate ourselves. And our history is really replete with examples of this, including racial zoning, restrictive covenants, racial steering, and blockbusting practices by realtors and other industry professionals. And the excerpts on the screen here are from industry manuals giving guidance on exactly how and why to discriminate against people of color, specifically Black people. Here we have the Realtors Industry Brochure, and then the excerpt from the FHA manual. And in that manual, it says that was from the 1930s and explicitly stated that neighborhoods of color are riskier investments. And in fact, by virtue of redlining, these neighborhoods were then deemed to have no value. So if you're not familiar with the term redlining was a credit risk assessment tool that was developed to determine which neighborhoods were safe for investment by the newly created Federal Housing Administration in the 1930s that was stood up in the wake of the Great Depression. And those that were deemed safe or coded green then received community investment dollars and mortgages. Those that were color coded red or redlined received none of that. Next slide. Another example of racist housing is zoning and the use of zoning as separation. So you may be familiar with zoning as a way of separating uses, but since its beginning, zoning was actually designed to separate users, and very specifically Black residents, again. So in 1910, Baltimore Mayor J. Barry Mahul justified the first zoning ordinance in the country as a public health and economic issue. And he stated in that justification that Blacks should be quarantined to limit the spread of communicable diseases, but also to protect white property values. And while zoning, and racial zoning specifically, was struck down in 1917, the racist practices persisted, and it essentially had the same effect. And so we relied more on an aggressive use of racially and ethnically restrictive covenants, utilized expulsive zoning, where undesirable land uses were then targeted towards low income and racial and ethnic communities. So things like trash dumps, factories, polluting factories, uses of that nature. And then the use of zoning was also used to restrict certain housing types. Back then, what was referred to as apartment homes, but what today we know as multifamily units. So again, all of these efforts really serve to depress the value of communities of racial and ethnic concentration, such that when we would go on to redline in the 1930s, we were essentially doubling down on existing patterns of segregation and codifying it into our national institutions. Next slide, please. And the impact of these legacies are with us today. So recent analysis of redlining maps across the country, and the picture on the left shows the number of communities where these maps were created in the 1930s. But recent analysis by the National Community Reinvestment Coalition found that nationally, 74% of areas that had been labeled hazardous or redlined in the 1930s remain low to moderate income today, and that 64% remain majority minoritized communities today. The map in the middle is the redlining map of Columbus, and the map on the far right is the analysis that NCRC did of our own community. And 82% of redline neighborhoods remain low to moderate income today in Columbus, and 47% remain majority minoritized communities. Next slide. So that is it was a very quick overview, but it's a long history of how we have manipulated housing to dictate who lives where, and what kind of amenities and tools we make available to some communities as opposed to other communities. And this leads us into discussing a little bit about social determinants of health, and then I know Dr. Kelly will pick this up a little bit more in his presentation. But for me, what's really critical to understand from this history and this legacy is that, contrary to mainstream messaging about individual behaviors really driving health outcomes, or even historically, right, the science that created and perpetuated a myth that Black people in particular were genetically inferior or more prone to disease. What we know irrefutably is that health outcomes are really driven by environment and access. So understanding the history of how our communities were designed and developed is so important, because as the definition of the social determinants of health states on this slide, it's the conditions within which people are born, live, work, play, and die. And those conditions are very much driven by government policy. And that government policy has a huge role to play in what the conditions look like for different groups of people. Next slide, please. And I would be remiss if we didn't talk about the role or the impact of this history, of this legacy, and of structural racism as a form of trauma. And if we go back to that first definition of racism as a system, then we can also see how racism and the systems of racism are traumatizing. That the systems within which we move can be and have been extremely traumatizing for certain groups of people. And that this chronic and intergenerational transfer of trauma has direct impacts also on the health outcomes that we see. And this shows up in these disparities as well. For example, looking at infant and maternal mortality rates. And to make the link with racism and racial justice work a little bit more explicit, trauma as a response to racialized violence. And our history, again, is filled with examples of racialized violence. Some of those policies that I just walked through are a form of racialized violence. So a definition of racialized violence would be the tools of oppression directed against communities of color, such as economic policies, cultural practices, political maneuvers, police brutality, criminal justice systems, hate crimes, genocide, colonialism, all of those things are used in the service of acquiring or maintaining institutional and structural power of white people at the expense of people of color. And so you can see how that form of violence, how those systems could be very traumatizing for the individuals on the receiving end. And I like this graphic because it really shows the different realms. And under here at the roots, I don't know if you can really see it on the screen, but it talks about things like historical trauma, lack of social capital and mobility, housing insecurity, homelessness, all of those kinds of conditions in which people are born or grow up or live in. Next slide, please. So moving forward, how do we turn some of this knowledge into action? And again, this was just a very quick overview, but one of the links we can take from knowledge into action is really how we have, as a community and communities across the state, next slide please, have declared racism as a public health crisis. Not only does this provide, I think, a very powerful counter narrative to the victim blaming that often goes along with health disparities, and we saw that even with COVID-19, if people would just mask up, or Black people don't wash their hands enough, or any kind of excuses and justifications that came out in the media, there were plenty. Again, I think making this declaration, it's a powerful counter narrative. It shows that we are recognizing the social determinants of health. And I think it really puts us on a path towards taking action. So now we've made these declarations, cities and counties across Ohio have made these declarations. And now we're really at the stage of where the work begins. And how do we move forward with putting words into action? And from our viewpoint as the YWCA, we'll continue to work with our public health officials and elected officials, business and nonprofit leaders in implementing this work, but then also holding people accountable to making progress on this work, because we know this is not a short-term intervention. We're talking about the transformation of systems that were built on foundations of racism that have been in place for over 400 years and counting. So it's a lot of history to contend with, a lot to make up for, but by declaring it a public health crisis, that means that gives us the opportunity, and it means that we will be looking at a broader range of systems. So all of those systems that correspond to the social determinants of health. So that requires looking at access to safe and stable housing, access to educational opportunities, good jobs, healthy food, safe recreation spaces, and of course, access to healthcare itself. So with that, I'll turn it over to Dr. Kelly to share more about how Nationwide Children's as an anchor institute is doing the work of transformation and intervening in social determinants on the near South Side.
Thanks, Jillian. Scott's pulling up my slides, but I want to say while he's doing that I'm thrilled to talk to you today. But I actually am excited because all that you have accomplished as a Rotary and young professionals in the community and making Columbus great. And one of the things at Nationwide Children's we do is we constantly throw up slides like this about how great we are, the largest, the biggest, the most research money, the safest, Parent Magazine, best of the best. But to be honest with you, next slide, please, Scott. Mm-hmm. What I'm here to talk about today is not the glory days of pounding on our chest as a Columbus, as a great community, because it is, and Children's Hospital is a great hospital because it is, but to talk to you as leaders because we are leaving people behind. There's a soft, Jillian gave us the statistics, the origin, the relationship of where this comes from, but you have to understand that in 8 neighborhoods, including this one on the south side that's on this picture here, they account for 15% of the population, but about 45% of all the babies dying in our community. They account for about 50% of all the gun violence in our community. They account for extremely high share of the Medicaid healthcare costs. They account for most of your policing costs. And if you've ever been to the courthouse, you will see that on any given morning, a lot of the people come from these neighborhoods just like this. And they have no attorneys, no representation, and a system that's stacked against them from the day one. Now, we in Columbus have allowed that to happen, mostly because we didn't know about it. But the evidence is increasingly coming out, and I want to talk about what we do know now and what we know can help. So this is the Healthy Neighborhoods, Healthy Families plot. We have 5 components: economic development, affordable housing, community enrichment, education, health and wellness. It's a joint project of United Way, the mayor's office, Community Development for All People, which is a faith-based organization, Nationwide Children's, and we partner with many other people, including the Y and several others, on specific projects. Next slide, please. And when we do that, the thing that most people know about is Healthy Homes, which is our impact where we do 80% of AMI people getting home repair grants, so elderly people in the community can stay in their homes and not lose their homes because of code violations. We also have increased home ownership in 120% income for average median income in communities. And I'll go into how many homes that's been. And we provide rental housing. So next slide, please. This is the home ownership part, more than 370 properties, residential properties so far. Before and after, we try to maintain the South Side architecture that's been down there, but we had children and families saying they couldn't allow their kids to walk to school because of blight and drug activity in these homes. So by changing the neighborhood, we can change the kind of environment that the community has out there. Next slide, Scott. And healthy rental homes is important because most people who have low income can't come into a neighborhood and be part of a neighborhood that is gentrifying. So on the south side of Columbus, we are aiming for 1,000 units of affordable rental units. And the same in the One Linden plan, 1,000 units of affordable rental units. So we are close to 500 now that are under contract or construction or in a stack, housing stack. And I'd love to talk about the capital stacks with all these partners on the bottom if you want to talk about that. But the idea is you got to build homes for sale for young families, and you have to make sure we have affordable properties so we can have a mixed income, sustainable communities in Columbus for long-term thriving. Next slide, please, Scott. And the vacancy rate, you can see that on the south side of Columbus, it actually reached almost to 30% at one point. But after the 2008 bubble, South Side had the highest vacancy rate in the city, almost 1 in 3 properties. This is at 1 in 4. And now we're down to the same average as at rest of the metropolitan statistical area, around 6%. It's actually dropped since this slide was done. So
Wow.
Vacancy is disappearing in these areas where we had a lot of blight, and we know this is transformable, and that's why the mayor and other folks have asked us to begin working in Linden as a next target community. But there's opportunity for growth in this kind of work. Next slide, please. Besides housing first, it's one thing to offer somebody housing, but you have to have sustainable income as well. And so we've developed a career ladder that starts with boot camp. And when I say boot camp, it is pretty much a boot camp. It's 40 hours a week for 2 straight weeks of learning appropriate professional behavior for people who may have never been exposed to a professional environment. So what is the hospital like? How do we greet people? How do we write email? How do we interact? How do we handle conflict, et cetera? And then we take people through a career ladder, and we've been working on job training. So we have now reentry programs from prison, reentry programs from people who've never worked or disabilities, and high school transformation. And large employers are needing to find good workers, and there's a surprising number of good workers that don't have a chance to get through the door in the first place. So I'll go next slide, please, Scott. This is our year-to-date progress in that one direct path that I showed you. To recruit 400 individuals and end up with 54 that are getting employed after they go through all the various steps requires a lot of one-on-one coaching and a lot of time. So as business leaders in the community, you know how hard it is to find employees and to maintain them, and these are the things that we need to do to make that happen. Next slide, please. So as you can see that we've hired basically 1,000 people from the neighborhood, but many of you may or may not know that software that we use to screen our employees actually rules out people from low-income neighborhoods. So you may be using a screening software like we were, and we actually had to go around that software in order to hire people from our very own neighborhood. So these are the kind of business decisions that we don't make consciously, and they can affect very much the livelihoods of people that Jillian described in her presentation. The next slide, please. Of course, many people came to us and said, well, that's fine, Kelly, but we've got a job, we've got a place, but no one to take care of the kids. So now we're hiring. We've expanded the number of childcare quality slots in Southside Learning Center. We've also doubled the capacity of our own childcare center to 250, and we're working on increasing the number of slots on the South Side. So, comprehensive development really requires asking the neighbors what they want. How can we work with them and find out what they need to make things happen? Next slide, please. And most importantly, we've become part of the neighborhood. Originally, we went into the neighborhood saying, we're going to do this for you and to you, and now it's a with. And I think it's important to understand that our faculty, our staff, they feel like they're part of the neighborhood now. They volunteer. We have more mentors than we can shake a stick at. And really, it's the management of the mentoring and the volunteers, because people are so committed to the neighborhood mission. Next slide, please. Play Streets, go ahead and click it again for me, Scott. It'll appear up here. It's one of those crazy animation slides. But closing off the streets during the summer and offering children the opportunity to both learn, but also to engage in activities on the streets with Columbus Police present, the Parks Department, food from the food bank, and lots of games and activities. And our staff volunteered to do this every weekend on their time off. Come down and block the streets off so they can play with the children. Next slide. It's not enough, though, for us to keep saying we're going to keep doing these things as a hospital and anchor institution. We have to actually develop leadership on the South Side to help set the agenda. And the South Side Neighborhood Leadership Academy is a partnership with Community Development for All People and United Way, has trained over 60 individual residents to join teams, to be on our committees, to help set governance, and to actually take a leadership role in choosing what happens to their neighborhood. Southside Thrive is a way of getting the organizations together there to all vote on the activities they see as fit. And for example, Southside Neighborhood Leadership Academy recently created an ID recovery service, because it turns out a lot of people on the South Side did not have proper identification, didn't have a way to enroll in benefits without identification, a birth certificate, or a social security card. And they created that themselves and found resources to start it, and we're now pitching in to help a little bit. Next slide, Scott. So actually, this is what I want to spend a couple minutes on because it's really most important. You know, the Rotary and Columbus, as I mentioned, and Nationwide Children's Hospital, when I moved to Columbus, these are great institutions, and they set the tone for everybody else. And so figuring out what you can do as individuals and as organizations, and first as organizations, how can you influence what's happening and why we have these disparities? You know, you may not know this, but the differential life expectancy between Franklinton and Upper Arlington is 28.7 years. So Franklinton in our city has the lowest life expectancy of anywhere in the state of Ohio, 61 years, whereas Upper Arlington is 87.8 years. And then you look at New Albany, same thing, 88-year life expectancy. And on the Near East Side, we have a life expectancy near my house in a couple neighborhoods that's down around 62 years. So people, where they're born, matters more than any medical buildings we build. We could build 100 children's hospitals and it would not affect that because these are social factors that affect kids early in their life. Environmental poisons, genetic effects that are lifelong, trauma, toxicity, exposure to violence, and hunger. And Columbus is allowing that to happen in part because our leaders don't know about it. So as a Rotary, what can you do? First, in your own businesses, policies matter. Parental leave, a living wage, and childcare will matter now more than ever after COVID. And if we don't take care of those things, if we treat our employees like paid consultants and contractors, we will be contributing to the problem. Businesses that care really matter. When employees, dependents, and neighborhoods interact, we have seen so much more employee satisfaction with the neighborhood activities. It's actually a recruiting tool for us. And I hope that you can see it in your business as well. Our volunteering is up at the hospital higher than it's been, even though people are busier than they've ever been. And our relationship with the neighborhood has become a us rather than a we and them. We've been in the paper in the past. I know 20 years ago, right before I came here, there were lots of headlines I read in retrospect that weren't so pretty. But the idea of being part of the neighborhood and actually the solution to the problem is really what we're trying to achieve. And your organizations can do that as well. Scott, could I have the next slide? I think I put Scott to sleep maybe. Oh, there it is. Okay, so as individuals and families and groups, you know, what are the options there? Well, first of all, you know, volunteering is great, but volunteering in relationship is what matters. Volunteering where it's an occasional activity is great. That's good for the kids to learn about and all that stuff. But volunteering really matters when there's relationship building and opportunity creation. And that's the difference. And investments, we have a lot of social entrepreneurship going on in Columbus right now. There's a hub here for it. But a lot of our business people don't know about social investment. And what about mission-related investment? What about funds that are aimed at building up our own neighborhoods or investing in our own credit unions and local communities? Of course, donations, but being in relationship is important. And that may mean moving. Our suburbs that block out school choice and school balance that has intensive zoning restrictions and don't allow affordable housing, that's part of the racism story we're telling today. And if you live in one of those communities, you're contributing to the problem if you're not trying to fix those issues. So I'm trying to challenge you. I'm being a little contentious. I hope you'll argue with me. But the bottom line is Rotary, young professionals, leaders in getting us to where we are. But for Columbus to be a truly great city, we have to take this next step. So I'll stop there, and I hope that I created enough contention that you'll fire some questions out at us.
So I do not see any questions in the chat at this time, but I am curious if either of you work at all with the Smart Columbus initiative. Anything crossover there?
We have a couple crossovers with Smart Columbus. So for example, in Linden, one of the initial items on Smart Columbus's grant proposal was the fact that many of the women in Linden cannot get to prenatal appointments. So infant mortality, as I mentioned before, we lose 2 babies in Columbus every week. usually sometimes 3 on average. And so a lot of women don't have prenatal care. And prenatal care is not the total solution. I don't want to imply that it'd be all fixed if we had transportation, but many of the solutions now involve creative uses of Uber and Lyft, and also using our smart shuttle now to, so some of the apps that are going to be used are going to be targeted at Linden to get people to medical care.
Can we talk? Can we talk instead of chatting on the question?
Yes.
Yeah, please.
I wanted to, Kelly, thank you very much. In response to what you said, you know, one thing we're doing in Upper Arlington now is as a group, we're trying to talk to council about source of income discrimination and having council pass a law not allowing discrimination in rent, you know, for renters based on source of income. And maybe Kelly, if you could please talk a little bit about Move to Prosper and what's happening there.
Yeah, it's a great. So thanks, Steve. So Move to Prosper is an innovative program that takes advantage of some research done on a large federal research project 10 years ago called Move to Opportunity. And in that program, people from neighborhoods were given an option to take a voucher and move to a better school district or a safer community, or live in a place that had a higher income. And renters could choose where to go among with a certain range. And it turns out those children, if they went early in life, those children did better academically, and even later on in life had higher income and less criminal activity, less drug abuse, and did better overall, especially the girls. And so if the boys went early enough, that also helped them too. But the bottom line is Move to Prosper is a local program to replicate some of that. And the pilot program of 10 families that went was very successful, and people did very well and with their kids in school. And now Move to Prosper is trying to garner enough support to do the next project, which is aimed at originally 150, it may be 100 women and their children moving to better communities. And I think that's what you're talking about, Steve. It's that mixed income, trying to have people and better integrated.
Exactly. And the other, I'm sorry, Scott, you want to?
No, go ahead, Steve.
No, I was going to say, because the other component with Move to Prosper, along with the voucher, along with rental assistance, is coaching. We have life coaches for each of the families. They're all female-headed households because Ohio State's doing the research, and they felt that would make the research more viable, rather than if you had a couple with children or a male-headed household and a female-headed household, then the research analysis might not be as valid. But as Kelly said, you know, hopefully that's. But again, that's 10. You know, it's 10 families. I guess what the other thing that many people do not realize is that of all the persons who are income eligible for housing vouchers in Central Ohio, there's only enough money for 25% of those families. So 75% of families that are income eligible for housing vouchers are basically in the private market looking for housing. And that you begin to wonder, why do you have homeless is not totally that situation, but you begin to get an idea of the magnitude of the issue when you think about it in those terms, I think.
I agree.
Jillian, did you have something that you wanted to share?
No, but Steve, you just to put a finer point on it. So at our family shelter, over 70% of our clients identify as African American, and something closer to 75% are single moms with children. And children is one of our fastest growing demographics of homelessness as well. So again, just thinking about the sheer insecurity and the disproportionate impact and effects that some of our systems are having on women of color in particular. It's also who we see in eviction court. If you've ever been to the 11th floor, well, you can't do that anymore, but, or go down to the convention center. I guess that's where we're doing it now, to be safer. Again, that's the majority of who you will see are people who don't necessarily look like me by race, maybe by gender,
Right.
but single women with children. Mm-hmm.
Yeah. The other thing I want to add is, you know, Otterbein in February started a new center there. Where I guess they're one of 23 colleges, universities in the United States. They have a Center for Truth, Healing, and Transformation.
Mm-hmm.
Okay, at Otterbein. And one of the things they're doing, if anybody looked at the New York Times, not this past Sunday, a week ago, a writer named Richard Rothstein wrote an article on what happened out in Hillsdale, California. And from something I read relatively recently in Westerville, they're going to try and do a similar study, which is to show what were the causes of the discrimination, as Kelly said earlier, about, you know, it wasn't an issue that African-American families didn't want to move into communities. You know, there were systemic issues that didn't allow them to move into the communities. And so you begin to look at the organizations that were formed, the banks that wouldn't lend to them, the real estate companies that wouldn't show them houses. I mean, that's what they did out in Hillsdale. And the impression I get is Westerville are going to try and do the same kind of analysis. And there's rumblings in Arlington of something like that being started, but we'll see.
Thanks, Steve. Scott, did you have a question too?
You know, I read this morning about a group, local group in the Linden area that's trying to take back their streets. It was in the dispatch this morning, or at least crossed my social media this morning. And I was wondering if any of the groups that have been involved in the South Side and with the YWCA are also engaging with those types of groups to help just make that area safer as well.
The Linden Partnership is part of a One Linden plan. And the One Linden plan was developed in partnership with the Neighborhood Development Department and Development Department of the city, led by the mayor and residents of Linden. Many of us from the South Side participated in various aspects of that and were involved. With regards to the direct violence thing, so Linden is one of the 3 communities that had the greatest increase in recent gun violence among youth. And it's really been a bloody summer already for us compared to what it usually is. And that's never a good thing. We are not, you know, we believe that going upstream is the solution, that children who are engaged earlier in education, who are in safe housing, when their parents are employed, and the kids have opportunities for learning after school and you know, activities that are structured, will do much better and are much less likely to be involved in gun violence. We are not right now engaged in direct gang disruption or violence prevention. The city is supposedly working on that with the police department, but I'm not really sure where that's headed right now.
YW is not involved in programming of that nature, specifically related to community violence, but we are exploring programming with our leadership development programs in Linden. So our Bright Futures, which is targeted to middle school aged girls, we used to offer it out of our downtown building, but in an effort to connect more closely with community and in acknowledging that the barriers for girls in our underserved neighborhoods to get to our downtown location, we're offering them in community, partnering with the rec centers. But right now everything's virtual, so we'll get there eventually, hopefully once things reopen, but that's where our partnership with Linden right now is.
Kelly and Jillian, this is Alex. Kind of in a slightly different vein, but I guess as a young professional and obviously knowing the audience of where this is going to go out to, the recording of this and kind of, those folks that are out there. I know one of my one of my friends and colleagues is on with us, who's an attorney. I'm a financial planner. What kind of advice would you give people like us that are kind of in our early in our career of how we can kind of plug in to these issues within the city best? Obviously we don't have gobs and gobs of money to go, throw out there, but we do have time, we have expertise. What do we do, to kind of foster that, like you were saying, that relationship piece? What should we do?
Well, we have many groups that are interested in assistance, especially the kind of professional assistance. So many groups, for example, a lot of not-for-profit neighborhood groups do not have legal expertise or advice on just starting up the 501c3, or how do I do this? What about accounting? Are there accountants that can just look over somebody's books and help them understand what's a good bookkeeping system to do something? So one of the things is to develop relationships with leaders in communities that don't have connections. It turns out that connections are the secret sauce in all this that make Columbus the city it is. And when all the connections are wrapped up in people who already have resources, there's not a lot of room for everybody else. And so allowing new people to come in, allowing new resources, allowing new access. How do you do that? There's a variety of ways, but I think, there are places like the Y, and there are places like the United Way. They know some up and coming groups that are trying to organize or trying to do things. The county poverty group called Rise Up, I can tell you, knows a lot of the young people that are out there trying to start things to make it better. I think also getting involved, I've been shocked at how many, like a couple of the people that I know that are wanting to donate to children's, and I said, look, first get involved with something. And the guy says, well, I ride bikes, what can I do? And I said, well, you could be involved in the bike shop. We have a co-op bike shop on the south side, and now he's on the board, and he's a donor, and he's gotten people involved, and he's got his company involved. I mean, that's the kind of thing. If your thing is food, if your thing is transportation, if your thing is accounting, if your thing is legal, there's a million connections. But it does take a break from the usual mode of, I'm always going to hang around the most powerful, richest people I know, because that's the way you advance your career. And suddenly it's saying, how do I help the community differently? Because we're leaving a big chunk of people behind. And they're mostly people of color. And they're mostly poor, and they mostly live in these communities. But that's who's moving to Columbus. That's what the auditor tells us. That is our future demographic. If we don't address that now, Columbus will not be the city we want it to be.
And I really, to Kelly's point, I think it really does come down to relationships and exposure. So as Kelly had mentioned, and I loved it, I was giving like a silent clap to, it's like, where do you live? What are you investing in, right? And so even while it might seem benign, I've decided to move to Upper Arlington because they have a great school district. Well, now you're investing in essentially white supremacy, right? Not that I'm sure it sounds like UA is doing some great things, but so if you're a constituent in that community, like get involved in some of those things. If those things aren't happening in your community, ask why. Show up to council meetings, show up to your neighborhood association or your area commission. When there's zoning review up for, at your area commission, ask like, how are the decisions being made? And is it with an eye towards equity and restoration, or is it kind of coming from a place of bias and discrimination? There's a lot of code words now being used, such as density, such as crime. And when you start hearing those coming out at zoning commission hearings or things of that nature, it's kind of a red flag. You can guess that there's some assumptions behind those words, that might be racially motivated, whether intentionally or not. So just interrogate kind of the systems that within which you are operating, and even your own organizations. What is their inclusion policy? What are they doing around paid family leave? What are they doing around the leadership development pipeline? How diverse are they? You know, everything from your hiring and recruitment process, like Kelly mentioned, the screening, to who's on the board and everything in between. So I think really just starting to question, if you haven't already, why things look the way they do within your sphere, and starting to try to chip away at that. And, you know, about relationships and exposure, the research on implicit bias shows that the number one way to counteract and start kind of pushing against our own implicit biases is by interacting with people who are different from us. And so again, you know, is that consistently volunteering in a relationship way. You know, we have, of course, we can't do it right now, but we have a very strong core of volunteers that come to our family center and weekly lead craft activities for the children every weekend, or serve meals, and it's very interactive in that way. So again, and like, once we are in a world where we're able to be together again, you know, how are we navigating our spaces, and who are we choosing to spend time with, I think are things that anybody can do, and they don't cost money, but are very, very important in terms of starting to work at our own internal biases.
And I'm happy to I have suggestions for specific volunteer things that other people from the business community have liked. And if you're interested in those, I'm happy to take communications, emails from people and make referrals.
We definitely are. So I would just like to interrupt, because I know we're coming up on our time.
Yes.
But I will just say to you, Jillian, and Dr. Kelly, Scott Brown and I have been in chat, kind of exchanging all these ideas about Columbus Rotary could do this, we could do that, we could do this. So you've really started sparking some great thoughts, and I foresee partnerships in the future. What that looks like exactly right now, I don't know, but I do think that there's some opportunity, and all of the things that you're talking about are things that align with Rotary. And so there's some wonderful opportunity there. But we would like to thank you for your time and all of the information that you shared. It was really eye-opening, and I know I heard several statistics that I was not aware of, and I hope that others gain some additional information for themselves too. Again, we look forward to finding ways that we can work with you and partner with you, and we want to thank you for this collaboration between myself and Columbus Rotary and Columbus Young Professionals. We appreciate your time, and we will be sending you a nice little thank you gift in the mail. Since we couldn't get together in person, we can't pass that off, but assume that you were in person, and I'm passing it to you now. You will be receiving something in the mail. So thank you again.
Thank you all. Have a great day.
Thank you,
I appreciate your
everybody.
time. Thank you.
Thanks.